All right, guys. So, one of you sent me a story on Twitter that I want to talk about. That is pretty interesting. Now, it involves Novant Health, a hospital, a group of hospitals, and their, I guess, marketing director, essentially discussing how to make the COVID-19 hospitalization numbers scarier to basically make people take the virus more serious. Now, I have to give some strong disclaimers on this because I thought a long time about should I do this video because, I'm trying to stay within the bounds on YouTube. Thoroughly read over the policies. I'm pretty sure it should be fine, but just in case, I got to get some disclaimers. I am not making any claims about the virus. I'm not making any claims about the vaccine. I'm not making any claims about pandemic. I'm not making claims about masks. I'm not making any claims about anything whatsoever. Okay? If you have any questions about the vaccine, the mask, the pandemic, the virus, please consult your medical professional. Please consult your doctor. This is simply about public policy and public policy only. Now, this is going to be a little bit of a more watered down version of what was said because, again, I'm trying to play it safe here. Again, I apologize. I just got to do what I got to do. But I'm going to play a clip of the local news covering this leaked conversation in which they are discussing, again, how to make the COVID-19 numbers scarier for the public so that the public takes the pandemic more serious. Take a look.
Where news comes first. This is WECT News at 6.
Good evening, I'm Bill Murray. Thank you very much for joining us. We begin with a story that's got all kinds of people talking tonight. New Hanover Regional Medical Center now issuing a statement after a video of an internal discussion on how the hospital reports its COVID-19 patient count was leaked on social media. Thank you very much for joining us. We appreciate that. The video has sparked discussion online, with some saying the conversation is proof hospitals falsifying COVID case counts, one of the many conspiracy theories circulating on social media. In the video, Dr. Mary Ruddick says she feels the hospital's messaging needs to be a little bit more scary for the public. And then she proposes including patients she characterized as post-COVID in the hospital's case count, the primary source of the outrage on social media. And after sorting through an apparent misunderstanding, Ruddick further explained her points.
I think those are important numbers, the patients that are still in the hospital, that are off the COVID floor, but still are occupying the hospital for a variety of reasons.
If you look at the Novant Health dashboard, they're listed as recovered, but I do think from our standpoint, we would still consider them a COVID patient because they're still healing.
All right, we can tell you just about an hour ago, Novant Health releasing the following statement. The team members involved in this excerpt of an internal meeting are seeing the highest level of COVID-19 hospitalizations and deaths so far in this pandemic, despite having safe and effective vaccines widely available. This was a frank discussion among medical and communications professionals on how we can more accurately convey the severity and the seriousness of what's happening inside our hospitals and throughout our communities. You can read Novant's full statement right now inside this story on WECT.com and the WECT News app.
All right, guys, so you saw that, you heard that, and again, I got to make it clear, I'm not pushing any conspiracies, okay? I'm simply analyzing, what was said and giving my opinions on what was said, okay? And there were also other things said in that video, but you can go find that yourself if you want to. Now, here's the thing. Essentially, the discussion was, well, we want the public to take the virus more serious, right? We want the public to know that, hey, our hospitals are full, okay? And that we have limited capacity. So how do we, display to the public the seriousness and the full impact of the virus? That's what the discussion was. Now, in my opinion, the answer to that question in terms of trying to accurately display the seriousness of the pandemic is to accurately display the numbers, right? You should try to be as transparent as possible and give as much detail as possible in regards to what the numbers are, right? So what that means is that if a patient is recovering from the virus, then you mark that person as recovering. They're still taking up a bed and room in the hospital, right? And then you also say, okay, well, these are people that are recovering that don't have COVID anymore. These are the people that do have COVID that are in the hospital. They're both in the hospital. So what is the point of trying to change the wording so that it looks like, you have more people in the hospital with COVID than the actual number of people you have in the hospital with COVID, right? Why would you do that? You should just be as transparent as possible and give as much details as possible, right? I mean, listen, you could break it down like this. These are COVID-related hospitalizations, okay? Here are the people with actual COVID that are hospitalized, and here are people that are recovering from COVID that are hospitalized, right? That is accurate and transparent. That way you can fully display, hey, this is the impact of COVID, and this is what the impact that it's having on hospitalization. Seems to be fair to me. Seems to be transparent to me. But when you having these conversations where you're like, oh, we need to make it scarier so that the public understands the seriousness of the pandemic, to me, again, I think you're working against your own best interest, right? The numbers should speak for themselves. And in my own personal life, I haven't been to the hospital, so I can't really say. I don't know. But I've tried to go to urgent cares or primary care doctors. And yeah, you got to make an appointment to go because there's a lot of people getting tested, right? So I've experienced that in my own personal life in which, you do have to wait to go get like urgent care treatment or primary care treatment because of COVID related stuff. So there's no doubt in my mind that there are hospitals across the country that are experiencing capacity limits because of this virus. And because of that, to me, it doesn't make sense why you have some hospitals that are basically threatening or have basically fired employees because of their vaccination status when you're already facing capacity restraints. It really doesn't make sense to me. Don't really make that much sense to me. But like I said, there's no doubt in my mind that there are hospitals that are experiencing this stuff. And I understand it. I get it. We're in the middle of a pandemic. But this is kind of what you sign up for, right? At some point in time, in human history and evolution, we're going to have pandemics, right? We're going to go through situations like this. And I just find it so interesting how a lot of these healthcare professionals are essentially complaining about something that they signed up for. Like, you signed up to serve in a time like this, because this is the type of stuff that happens, right? We've had pandemics all throughout history. It happens periodically from time to time. In my mind, again, I'm not a healthcare professional. I'm not in the medical field, but I would think that if I'm going into that field, I'm signing up to deal with stuff like this periodically, right? That's what I'm signing up for. So again, I just find it funny how some of these people are complaining because, okay, yes, you've had to work hard for the past year. Again, I get it. But again, when I was working in the financial services industry doing tax season, I had to work really, really hard, right? I had to work real hard. Okay. So it happens. People have busy seasons when it comes to their careers. People go through things where, yeah, you're going to have to work a little bit extra harder. But hopefully it's not like that forever. Hopefully we overcome. But I do understand the idea of wanting people to understand how much resources are being used by these hospitals because of this virus. I get that. And I think accurately displaying the numbers for what they are, right? Being accurate and honest about who's in the hospital and why they're in the hospital is the best way to do it, right? Not trying to finagle around the wording and the language and the numbers to try to make it seem like things are more serious than what it is. If it's serious, it's serious. If you're overwhelmed, you're overwhelmed. Those numbers will speak for themselves. So, like I said, man, I just found this story to be interesting. Hopefully, I don't get punished by the YouTube gods for simply discussing this story. But let me know what you guys think. Make sure you like, comment, and subscribe. Most importantly, share a Black conservative perspective. Peace.